Here is your stem. Okay, 1 minute to read the stem. If you've read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
I will manage this patient according to ABCD protocol. I will manage the patient after admitting into high dependency unit or intensive care unit. At first, I will start. I will talk to the patient to check patient's airway, and then if it's present, I will go for breathing. Then I will give supplemental oxygen. I will as well as I will give analgesia according to WHO analgesia ladder. And then I will go for circulation. If I will start aggressive resuscitation of the patient by crystalline fluid, and I will go for invasive monitoring of patient's vitals, urine output, central venous pressure, as well as blood gas analysis. And I will frequently monitor patients' hematological and biological parameters as I'm considering pancreatitis. In this case, liver function, renal function, clotting profile, as well as serum calcium and blood glucose will be monitored frequently.
Okay. Can
I
you
will.
tell me why do you think patient is tachypneic?
Yeah, patient is tachypneic. It might be due to stress response, where overstimulation of sympathetic system may happen, and it may also be caused by other events like ARDS or any pancreatic pseudocyst for pressure hypertension.
Can you define ARDS?
Acute respiratory distress syndrome. According to can I pass, ma'am?
Okay.
I will update it.
Kindly comment on the serum amylase levels.
Yeah, here serum amylase is high.
What is the normal value?
Sorry, ma'am.
Okay. Which enzymes are important if you want to establish the diagnosis of acute pancreatitis?
Serum lipase
All
is
right.
more
Okay.
than
Yeah,
serum
that's
amylase.
important. All right.
Also, LDL.
Tell me two situations in which patient has acute pancreatitis, but serum amylase levels appear to be normal.
Yeah, if patient present late, as serum amylase may return to normal level after 48 hours, and it is also not that much specific for pancreatic tissue. It may also get elevated in other condition as well.
Too early or too late? Two situations. Okay. If you want to establish your diagnosis as acute pancreatitis, what are the criterias you will keep in your mind, or according to which criteria you would establish your diagnosis?
There are certain criteria like Glasgow criteria, Ransom's criteria, Balthazar scoring system, Apache scoring system.
Please
And
tell me Ransom's criteria 48 hours after.
okay, after 48
Admission.
hours,
Yes.
hematocrit will drop 10% or more. There will be sequestration more than 6 liter, serum calcium less than 2 millimole per liter, partial pressure of oxygen fall less than 8 kilopascal or 60 millimeter mercury, Blood urine nitrogen may rise more than 1.98 millimole per liter, and base deficit more than 4 millimole per liter.
Yes. Okay. Please tell me, what are the causes of hyperglycemia in a patient who presents with acute pancreatitis?
It may be due to destruction of beta cell that will decrease the release of insulin, and may also caused by due to stress response where blood glucose level gets high.
How would you take care of the nutritional status of the patient?
In severe case, I will have to give total parenteral nutrition, but in early case, I may have give enteral feeding by nasojejunal tube.
Okay. What about the role of antibiotic in patients suffering from acute pancreatitis?
If I suspect cholangitis with it, I will give antibiotic, and other conditions like if there's any sepsis or pancreatic abscess, or if I consider ERCP, I will give antibiotic before that.
If you'll consider ERCP in this scenario, in this patient?
Not
Okay.
in this scenario.
Right. What are the causes that can lead to acute pancreatitis?
It may be idiopathic or other conditions like gallstone, chronic alcoholism, trauma, trauma, abdominal trauma, snake bite, viral infections like mumps, autoimmune conditions, and drugs like steroid,
Okay. Can
oral
you
contraceptive
please
azathioprine.
tell me, if you fail to manage this patient on time, what are the complications that can result?
There are certain local complications and systemic complications. Local complications like pancreatic abscess, necrosis, or pancreatic pseudocyst, splenic vein thrombosis. This may happen in systemic complications like ARDS, systemic inflammatory response syndrome, ARDS, hypovolemic shock, DIC, or other metabolic derangements like hypocalcemia, hypomagnesemia, hypoalbuminemia, hyperglycemia. This may happen.
What is pseudocyst?
Pseudocyst is amylase-rich fluid collection surrounded by fibrous or granulation tissue that may occur 4 weeks or later after the onset of symptom of pancreatitis.
How would you confirm your diagnosis of pseudocyst?
At first, I will have suspicion if I get a high serum amylase 4 weeks after the onset of symptom. And if I suspect, I will go for CT scan. At first, ultrasonography of abdomen, and then CT scan. I may go for MRI as well. And if pancreatic cirrhosis is confirmed, I will take fluid for analysis.
Okay. Right. What are the complications that can result because of the presence of pseudocyst?
It may get infected and may cause abscess formation or intra-abdominal sepsis. If it gets ruptured into gut, it may cause gastric bleeding. If into peritoneum, it may cause peritonitis. If
Yes.
it gets enlarged, it may cause pressure. If it cause pain, it may obstruct common bile duct, may cause obstructive jaundice or intestinal obstruction. If it gets
How
if it
should
gets
a
ruptured into
patient with pseudocyst be managed?
cirrhosis may resolve within 1 to 2 weeks. If it in certain conditions, it will need operative management. Like if it persists for more than 2 months, if it gets enlarged more than 6 centimeter, or if it gets infected, I will go for surgical management, and it will be cystogastrostomy or cystojejunostomy.
All right. How would you differentiate if it is a pseudocyst or a pancreatic tumor?
By analyzing the fluid from the cyst,
Serum amylase.
Okay. If serum
Yes,
amylase is
simple.
more higher, then I will consider cirrhosis. If
Yes.
in case of tumor, carcinoembryonic antigen,
What
and CA19.
are the signs and symptoms with which patient presents if you suspect that patient has
There will be epigastric swelling, upper abdominal discomfort, vomiting, or low-grade fever,
and dyspepsia?
and dyspepsia.
Yes, good. Thank you.